To the latest episode of the Pandemic Podcast with me, Dan Astin-Gregory, today joined by Dr. Steve James, somewhat of a folk hero of late, given his confrontation with Sajid Javid, which has obviously been highly publicised in the media. Delighted to be having this conversation off the back of Monday's decision, where hopefully hundreds of thousands, up to 100,000 jobs have been saved as a result of the change in the mandate. So you're a critical care consultant. You have a specialism in testing around exercise and breathing, all kinds of background understanding of a multitude of expertise. You've spent the last 2 years in critical care, is that right? Working with COVID patients directly?
Yes.
Yes, you have. Okay, so tell me a little bit, what led you to confront? I mean, how did you end up in that situation? You know, the cameras are on, Sajid is there. It takes some guts, surely, to speak out in such a way when the rest of the media is pointing in a different direction.
Well, I suppose I'd wished for the opportunity to say something.
Yes.
It had come across my mind before that I would just like to talk to the people who are making these decisions, as I'm sure many hundreds of people have had those sorts of thoughts themselves.
Indeed.
I was delighted when I heard that morning that Sajid Javid was coming to King's and was coming to the unit which I was the consultant for, which was the unit where the patients who are COVID or are positive for SARS were gathered. So I didn't jump out of my chair when I heard it, but I thought to myself, I will take the opportunity to say something.
And of course, I've had the opportunity to speak with hundreds of NHS doctors, surgeons, nurses who were really concerned that their livelihoods were going to be decimated by this. I even spoke to a nursing student who was in her 6th year of practice, and she was really concerned that her career would be over before it was even started. So I think that's what's led to you being that kind of folklore status, because you had the courage to do that in that environment when so many people are thinking this but not having the opportunity to say it. I mean, how did it feel at the moment when you took that opportunity? Because obviously Sajid approached the nurses and they kind of looked flabbergasted, and then you took the lead, quite fortunately. How did it feel when you did that?
Well, I expected to take the chance myself rather than be offered the sort of shot in front of goal as Sajid provided.
Yes.
So when I saw him talking to the nurses, I felt a sense of discomfort for them because I didn't feel like they wanted to speak. I didn't want to step in too quickly, but I just couldn't resist that chance. When I started talking, I could hear myself monitoring what was going on and saying to myself, okay, your heart is pounding, you are tense, but the words are coming out okay.
Yes.
So just keep going.
Absolutely.
Because this is the chance to say some things that others haven't had a chance to say.
Indeed. Now, obviously, this has been something that's in the works for a while now. We've seen the same situation in the care homes. What was your initial reaction when you heard about the potential for mandates that could affect the NHS workers in this way?
I thought it was ridiculous. I thought it was a huge moral blunder to mandate, especially in the NHS staff, vaccination. I think we'll chat about why I think that. But I thought, oh, come on, this is going to get some. There's going to be some review process in the House of Lords or House of Commons, and they're going to chuck it out and they're going to say this is nonsense. And then it was all shooed in very quickly before Christmas time. By which point I'd just written a letter to my colleagues at King's to say, look, I think we should stand up and protest against this, vaccinated or unvaccinated. But we just had the news that Omicron was spreading. We just weren't quite sure. So some colleagues said to me, look, Steve, maybe just wait a little bit until we know what's gone on with Omicron, whether it's created a new wave or not. So I decided to wait a little bit and see what would happen. But I was, livid about it from the beginning.
Yes. I mean, Omicron is being cited as one of the reasons why the mandates have been pulled back. But your point is, I think, we're an important one around the moral argument. And like many policies we've seen in the last 2 years, it seems like many of them have been moralized to a point where we have this moral dilemma. What do you think is the moral argument? Obviously, the strong argument around protecting one's right to informed consent. How has this become so politicized?
Well, it's got to be clear that your ability to decide what you have put into your body is your choice. And to say that it's your choice, you can still leave your job, just isn't fair. It's coercion. Everyone knows that. You've got to be able to make a living. It's not like you can go and walk next door and walk into another healthcare facility and just join a different company. It's just no possibility in England to work under the rules they had. Now, if you're going to bypass bodily autonomy, if you're going to put out a mandate, you've got to have a rock solid case with a rock solid benefit. And those were never there with Delta. And the evidence with Delta, which I described a little bit to Sajid Javid in the moment I spoke to him, it's actually data from household contacts. And it was data from people who've got the AstraZeneca or Oxford vaccine. And it showed that for them, actually it's about after 3 months, I said 2 months, the protection for people who are vaccinated versus unvaccinated and without prior infection, it's gone back down to zero by about 3 months. So if you're already protected from having previous exposure, you've probably only got an advantage of being vaccinated maybe of a month or something, which would require staff to be vaccinated on a much more regular basis.
Yes.
And that's just the household contact situation. So it's very different in the hospital. So that one of the differences is you've got a very high rate of prior exposure to infection in the healthcare setting. You've already got a high level of vaccination as well. You've then got the fact that as long as you're well enough staffed, you don't come to work if you're sick.
Yes.
So you stay at home. So we know that asymptomatic transmission's more about computer modeling than it is about real world data.
Indeed.
So you stay at home when you're sick. You don't come in. Then when you're in work, you wear PPE. When you're in work, you maintain distance from patients. You don't stay in close proximity for a long time. And ventilation, while not ideal in hospitals, is much better than it is at home.
Indeed.
So the data from household contacts isn't something that I think is totally relevant in the first place to the hospital setting.
Now, this argument around prior infection is an important one. I did speak to an American doctor who said, first and foremost, those who have had prior infection should be given the option of being excluded from any vaccination campaign. But I returned the argument and said, well, we then make it about whether you're infected or not. And, we've seen chickenpox parties in the past in order to get immunity. And I question, would that lead to a drive to something similar? COVID parties and people driving themselves to get naturally infected. What's your view if they had gone down that kind of route where they included that in terms of an exemption versus simply removing the mandates?
Yeah, well, what I initially said about the fact that I'd been previously exposed, in some ways I regretted at some point saying that, because although it made a clear case against the mandates in some ways, what it didn't do is say that primarily the point is that you need to make a convincing moral argument.
Yes.
And with that, you need to have a weight of science, and that was never there. So I wouldn't have liked it to have gone down that route, and I was very relieved that the government didn't decide, okay, we're going to allow those with prior immunity to be exempt from the mandate, because there's a lot of people who don't have prior immunity but just don't want to be vaccinated.
Indeed. And how important do you think within healthcare to preserve that choice, particularly for the healthcare workers? Because from speaking to countless healthcare workers, they take pride in that informed consent with patient relationship.
Well, it's absolutely central to what you do. You look at the benefits, you look at the risks, and you weigh those up in light of the patient, or the patient weighs them up in light for themselves. If they've got the ability to consent for themselves. So in intensive care, they haven't always got that ability. So, if you look at vaccination, the benefits for the individual are fairly well described, particularly focusing on those who are over 65 and got the comorbidities. For those who are younger or without comorbidities, the benefits are not clear. As far as the benefit to others from reduced transmission, that's, like we just said, fairly small, fairly short-lived, and with Omicron absolutely gone. The risks. Well, we're still in the trial phase. Yes. We don't really have clarity on the risks. A lot of people are much more concerned about the lack of evidence than others. Some people aren't worried about it. But then you've got to weigh that up where you've got those unknowns in light of each individual's preferences.
Yes.
And there are a lot of people from certain communities who have a lot of distrust, and their lack of trust in the government is not made any better by a mandate. It's made worse.
Well, I think you make an important point around the moral argument. I think, to me, that's the dominant argument in this piece. Of course, the vaccines themselves play a role. But on the vaccine point, why do you think, without getting into too much detail around the risks themselves, why do you think the public square or the scientific community is so reluctant to embrace a conversation about the varying degrees of efficacy and risk? It seems almost like a taboo subject, and it's...
I think that we are in general not good at presenting risk to the public. We're afraid that they'll make a bad choice if we give them all the data.
Right.
And to me, that's a hangover of the old sort of paternalism of medicine. I think patients will do much better and will have much better relationship with their health carers if the health carers show to them a sort of a risk box system where you say these are the benefits and the risks of having treatment versus not having the treatment.
Yes.
So I think we're in general uncomfortable with the idea that we might put someone off something by telling them the truth about risk.
Yes.
And that's fundamentally a lack of trust in another human being.
I think those components are so important in the consent equation, having that information. So where there's that reluctance to enter into that dialogue,
that's good medical
difficult.
practice. So if you follow what good medical practice is, you should be doing these things. But once, and this is people in general, once we start to think that something's a really good idea, we start to get a bit blind about when it might not be a good idea. If you're a hammer, everything looks like a nail. Right?
Yes. And the other component of this is it seems like many of the policies have been treated as though, and you've seen lots of different COVID cases, I'm sure, in your last couple of years, it's almost treated as though COVID is this, it affects everyone similar in the same way. There's no discernment for the varying risk factors based upon someone's age, comorbidities, obesity, whether they're obese, versus those who are probably less inclined to become seriously ill. Of course, there's always exceptions with any illness, but surely if you're taking a broad brush policy like this, you're not factoring into the fact that people of all shapes and sizes are going to have a different response to COVID.
The response is hugely varied based on your health conditions. In the 2 years I've been working on intensive care, I've seen one patient who was my sort of age and didn't have anything other than a single comorbidity. That comorbidity was an inflammatory condition within their airways, which I think would have very much predisposed them to the problems. But everybody else had a good smattering of comorbidities. An awful lot of patients were overweight, and by that I mean morbidly obese. And I'm sure that the patients who were only technically overweight or in the early stages of obesity have also got a much more increased rate of presentation. Obesity is such a prevalent problem in our hospitals, we no longer really notice it. So unless a patient is, let's say, typical height and 130, 140 plus kilos, we don't often make note of it.
Well, I think this is important because in the context of a policy, a broad policy like a blanket mandate, where the risk is dissimilar, where it's not uniform, then to me it's another argument that invalidates the lack of choice. Surely if someone is fit, healthy, young, given that what you said about the vaccine is more of an individual protection, if that's the kind of premise of the product, then surely then someone should have the choice based upon their own well-being.
Yeah, I mean, you've got to then sort of wonder why should someone who's at risk not have choice, whereas someone who's not at risk not have choice. Actually, everybody should have choice. But if you are clear from the beginning that it's a fairly narrow group of people who are really going to benefit from the vaccine, then I think you get more honest. You say, look, this is the risk profile in these people. These are the risks of the vaccine. These are the benefits of the vaccine. And it's pretty clear that for those group, it's a huge way in for the vaccine's benefit, I think. Although I still haven't really gone through the data there. Like I was saying beforehand, I'm a clinician. I'm thinking about how does this policy affect the patients I'm looking after? How does lockdown affect my kids? How does how can I travel? How can I do this? How can I do that? Does all this make sense? Yeah. And I just think that we were afraid as a society to nuance and say what it is. I think an element of it was everyone knew from the beginning obesity was a huge part of it, and there was concern about focusing on people being overweight as a problem and targeting those people for measures. But if you look at like a large population, a large spread of the population from 18 to 65, and then you look at the risk reduction you get, although what we call the relative risk reduction is relatively large, the absolute percentages are pretty tiny, because not that many people get COVID and die in the first place. And when you flip those numbers on their head and you turn them into what's called a number needed to treat, then you need about 10,000 vaccinations in the average 18 to 65-year-old population in order to stop one death.
Right.
Okay. If you then split that group into those who've got comorbidities and those who haven't got comorbidities, well, we know as far as ITU concerns, they're kind of presenting at 99 to 1. Then the actual number of vaccinations you'd need to have as a healthy 18 to 65-year-old compared with the group where most of the risk is going to be in the other end.
Yes.
We're talking about 1 in 100,000 or 1 in a million people.
Yes. So do you think the government has then taken a kind of lowest common denominator approach with all of their blanket policies?
Yeah, they've said, why do we cast the net? The more people who are vulnerable will catch. We know that. I can't say I see the logic.
Yes.
I can't say that. How to put it? Can't say I understand the willingness to vaccinate as many people who I consider to be extremely low risk as they've done.
Well, when you take it back to the beginning of the campaign, the head of the vaccine program at the time was saying this is very much an adult product. It's for the most at risk. It just changed almost overnight. Now, we're not here to talk about the vaccine rollout. It's clearly an integral part, but protecting informed choice is so essential. You've taken a stand. How has that been received amongst your colleagues now? And do you get stopped in the corridors, in the wards? People challenging you? Do you see all sides of the story? Have you become a figurehead now? What's life like in the hospitals?
So people are coming up to me in the corridors. Most people who are coming up to me are nursing staff, porters, junior doctors, saying thank you and it's great what you've done. Now with the mandates being dropped, really happy about it. Amongst my colleagues, some have reached out to say well done locally, and have had hundreds of emails from people. I'm sorry I haven't been able to answer everything. Yes. I'll get around to it one day, but I have been a bit busy. I hope everyone understands that.
Yes.
From right across the country saying thank you for what you've done, for speaking up, for having a voice where other voices haven't been heard. I know that some of my colleagues are concerned that I'm not a vaccine expert, I'm not an epidemiologist, and I might put people off. I think that the broad brush approach has put people off. Mandating has put people off. And I think if there's a chance for me at one point to use the fact that I think people trust me as a doctor because I've spoken out against a single narrative, hopefully in the long term I can counter anything from there with other work I might be able to achieve.
Excellent. And you've taken this on as a real campaign now, that you're helping spearhead a legal challenge. Obviously, in the light of what's happened on Monday, is that legal challenge still going ahead? And you can tell us a little bit about that?
Yeah, so what we don't want is the government says, it's not. Well, the government has said, the key thing they said on Monday is it's no longer proportionate. And that is absolutely key legal speak. That means that a mandate cannot, in its current form, be legal.
Yes.
So if any trust or college or regulatory body wants to put in a mandate now based on the current situation, it is no longer proportionate,
Right.
and therefore invalid. But what we don't want is the possibility for the government in the future to come along and say, oh, well, now a mandate's right. So we need to say, look, this process of trying to go about putting in place a mandate was completely wrong from the beginning. It wasn't right when Delta was there, and it's not right now that Omicron's there. So we want to carry on with that and make sure that it's very clear that that shouldn't have happened in the first place.
Yes.
And if there are any trusts or organisations that feel they are still going to go ahead with that, then they will become who the legal challenge is against. So the government have protected themselves by saying we're taking it away. But if others step forwards and carry that mandate forwards, they will be the target of a legal challenge.
Well, we've seen that in the private sector amongst private business. Do you think that's a likelihood within the NHS? Is there any evidence that happening already in light of what's happened on Monday?
So there are some trusts that are still saying you've got to still give us information, which was never true because you didn't have to share information with your trust until April the 1st when the laws would have come in.
Yes.
So they're still pushing the wrong message. They're still pushing the wrong message. I think the regulatory bodies will probably come out with something that says we advise taking the vaccine, but I don't think they'll insist upon it. So no one has clearly come out saying they're going to do it at the moment.
Right. Okay. Well, it's great to hear that you're going to progress with the legal case. I think that gives hope to a lot of people because the difficulty with this particular decision is that the moment we accept the erosion of bodily autonomy and informed choice, that becomes then a slippery slope. First today it's a COVID vaccine. What could it be tomorrow?
Yeah.
So I feel like this is a landmark occasion where if we can preserve informed consent now in this particular issue, it creates a barrier against future challenges against that ability to choose. Is that the way you see this?
Yeah, I think it's a line to be drawn in the sand and to say, get back over that line, and the public and the judiciary can recognise that.
And then in terms of the staffing now, you've spoken about how you've had positive feedback from the staff. In light of what's happened on Monday, have you seen anyone continue to leave their jobs out of principle? Had people already left their jobs? And what kind of predicament has that left the NHS in?
A lot of the people I've spoken to have been disgusted with the NHS, the people who are going to leave. They felt hassled and let down by their managers, both their direct managers as well as the executive teams. They just can't fathom why a chief exec wouldn't try and protect 1,400 members of staff tooth and nail in order to go against this from the beginning. I think there's been a missed opportunity for some of them to have been the champions of people they'd like to be seen as, and to step forwards at different stages and say, actually, we don't think this is right, and we'd like the government to stop and to think again, and to come out with the argument for why. I don't know whether they were afraid of losing their job or what else was going on, but 100,000 other people were afraid of losing their job and decided that they were going to stick to what they thought was right. So I don't know.
Were you afraid of any consequences of speaking out when you did? Obviously, you were very considered in your approach with Sajid. Has there been any consequence? Were you afraid? Are you concerned that things could happen as a result of taking that stand?
No, I'm not concerned. I'm much more concerned about not speaking my own truth. I feel that there's been an alignment for myself on a sort of inner basis that I've suddenly come into contact with a lot of people who think similarly to me, particularly those people from the Together Declaration and NHS 100K.
Yes.
People who are prepared to say how they see things. So if I've lost some contacts from before, I don't regret those losses. And personally, I feel, there's this old phrase, can you still look at yourself in the mirror, when you go and take a shave? I feel a sense of personal honour when it came to a difficult moment, I stood by what I wanted to do, and I did it.
No, good on you. And now my final question around this piece is, how do we've got this thesis position and we've got the antithesis position here. How do we get to a place of synthesis where we can actually have this important conversation about informed consent without the kind of division or being accused of being anti-vaxxers because you've taken a position on choice? How do we break down the silos and the divide? How do we get some united polarity around this conversation? Is there things we can do to enable this conversation more broadly?
I think it's a job of everybody to speak with friends and family about how they see these topics. I think we've currently accepted an awful lot of advice from what the government has given us, and we've simply repeated those things. And it's important, I think, to challenge those concepts with the people that you live with. When you are at work, and to ask people why, and to stop it being a completely polarized position, but to kind of, put some reasons down and to allow the other person the opportunity to move position a little bit rather than to think they've got to come right over to your point of view. And also have the flexibility to be able to move your own position too.
I suppose my final question is, a lot of the audience have asked me to ask you about the future of the NHS and the future of healthcare. What do you think the future looks like in terms of healthcare? We've seen in recent weeks this news around the digitization of the NHS, which I think will have lots of benefits to the systems inside, but people are concerned that the personal medical care is going to start to dissolve, and we're going to have more of this kind of pharmaceutical industrial complex way of operating. What is the future of healthcare looks like in your mind, and what could we do to transform the future of health as we move forward from COVID-19?
Well, what struck me when I first started working on intensive care was the extremely high level of environmental or lifestyle-induced medical conditions that make up the background for why people are intensive care.
Yes.
Sure, there are some people there who've got a brain tumour, some have been injured in a car crash, but the vast majority of people are in intensive care because of comorbidities that are chronic diseases that could have been prevented. I just think the word healthcare isn't what we do in the NHS full stop. It's sick care. And we as a society want to have healthcare. And for me, healthcare needs to be delivered as well as sick care being delivered. So, we need to, if we rename the NHS, and I know there are concerns about the NHS being renamed NHSX and other things like this, we need a service that's basically as big as the NHS to drive health in the country. That's, to me, whether you change the type of sticky plaster you use doesn't change the nature of the wound.
Indeed.
I would like to see a huge shift towards education and understanding for health. I'd like to move into that direction more myself. I have ideas about building a sort of online health community to allow people to support each other with the right sort of information, to be a sort of channel for some of that information myself.
Amazing.
And to try and to help people to shift the needle themselves.
Yes, I mean, that is good. That is a shift, for the public healthcare, as you say. It does an excellent job at emergency care, sick care. There'd be quite a transformation. Do you think the appetite is there within the public sector to drive that preventative healthcare?
No, I don't think the appetite. I mean, we've known about preventative healthcare since, at least when I was at medical school. I remember reading some of the statistics and going, but wait a minute, why aren't we putting the money into this if we know that's what makes the difference? There needs to be an initiative from scratch. It shouldn't be that we're fighting over money for cancer or money for this. The bills for social care would be reduced. The bills for health care, the NHS, would be reduced. The ability for people to live a longer, working, productive life would be better. So many things would benefit if our health was maintained from the beginning.
Indeed. Now, the last thing, you've been on the case, you've been on the media, you've been involved with the legal campaign. What's next for you on this campaign to protect informed consent and the right to choose? So
I'm carrying on working with Together Declaration. Very pleased to sort of be joining with them a little bit more formally over the next week or so.
Excellent.
We want to see the old normal back fully. There is no need for there to be restrictions based on, testing, travel restrictions, quarantine, where you should treat COVID as the disease we find it. If you're sick, you stay at home and you don't go out and spread it to other people. And all the things actually people would have done in the first place without being locked down and forced to do things. There needs to be, for example, in Scotland and in Wales, there are forms of segregation for people or discrimination.
Yes.
So in Scotland, you can't get fertility treatment, I understand, if you're unvaccinated.
Right.
Things like this needs to be gone, and we need to make sure these things never come back again. So all the rules basically around COVID need to go.
Yes, I mean, that's what we'd call Common Sense Corner here on the Pandemic Podcast. Well, thank you, Dr. James. It's been a real pleasure having you here, Dan. And what a fascinating conversation. It's great also to hear your views about what the future of preventative healthcare like that. I share that desire and dream myself. So thank you so much for being here. Wonderful conversation. And for our audience who've watched this, please do share this conversation. This is such an important conversation, as we've talked about here. This is the sort of conversation we need to have in the home. We need to be courageous enough. We can have people like Steve who's going to step up in the hospitals when the politicians come storming in. But it's one for all of us to have this conversation. This is the future of society that we're dealing with here. And I encourage all of you to share this video as part of that process. So thank you again. And thank you for sharing this video.
Cheers.